Welcome to The Better Life with Dr. Mary Ann Pinkston. Join Dr. Pinkston today as she teaches you how an integrative approach to health, combining holistic and contemporary medical information, can lead you to the better life. And now, here's your host, Dr. Mary Ann Pinkston.
Hi, good morning, everybody. Dr. Mary Ann Pinkston here with The Better Life, with Dr. Pinkston, of course. And today I have a great guest that I would love to bring out the myth and the mystery around acupuncture. I know so many patients ask me about acupuncture, and many people don't really understand it. Some people have read up about it, know it, and love it, but can't find anybody in San Antonio, so always asking me for references. So guess what? I have one today, and somebody that I've come to know over about the last year with Global Pain Association on the board, and we've had some great lectures and things. And Scot Taylor is here today, and he's with Balance Acupuncture and Natural Medicine. So Scot, welcome in. I'm so glad to have you on.
Good morning, Mary Ann. Thank you for having me.
Absolutely.
I appreciate it. It's nice to be here.
Yeah, I'm so happy to have you here because I'm very serious about patients asking me all the time. And there's really not a lot of people here in San Antonio that do acupuncture or do it right. Let's put it that way. So I know you do, and so give us a little bit of background on you and what you do.
Okay, sure. Yeah, I have a master's degree in acupuncture and Oriental medicine, or East Asian medicine. And I've been in practice for 22 years. My practice is in the north central San Antonio area.
Very accessible.
Yep, very accessible, yeah. And we have a specialty in chronic pain, as well as women's health, fertility, migraines, neuropathy.
Wow.
Yeah, so acupuncture can be very effective for a lot of different conditions.
So that's interesting. I feel like, since I practice integrative medicine, that I feel like I know a lot about it. I really don't. And so you say fertility. You can do acupuncture for fertility.
Absolutely.
That's interesting. Explain that a little bit.
So the basic idea with acupuncture is it helps to just promote your body's ability to regulate its own function and to heal itself. I know you practice functional medicine. And Chinese medicine is one of the earliest forms of functional medicine. We're not really, when we treat patients, we're not really so much concerned with making their symptoms go away, right? So a lot of times people come in, it's like the reason they come in is because they want their back pain to go away, or they want to promote their fertility, or want their menstrual cramps to go away.
Sure.
But really, we place our focus on how their body is functioning. And when we do our diagnostics, we're trying to figure out, okay, well, the body is supposed to function in a specific way. And if it's not doing that, well, where is that communication breaking down? So when we have a patient that wants to work on fertility, we look not just at their menstrual cycle, although we do place a lot of attention on that because there are certain pieces of that puzzle that need to be working optimally in order to achieve a pregnancy. But we also look at their health in general. So, how are you sleeping? How's your digestion? So we really kind of look at the whole person. And then in Chinese medicine, we diagnose according to what we call patterns of disharmony. So we're looking for, like I said, these systems of the body that are not functioning the way that they're meant to. And then we use a combination of acupuncture, Chinese herbal medicine. Right. Of course, we always address lifestyle with patients.
Yeah.
The way Chinese medicine looks at dysfunction and the disease that results from dysfunction is that there's something that's not working according to plan, and a lot of times that comes back to lifestyle, right? Adequate sleep is essential. A good quality, balanced diet is essential. Knowing how to get your body out of that stress response, out of that sympathetic fight or flight state that so many, I think, Americans and Western people in general,
no doubt,
spend their life just a little bit too deep into that sympathetic fight or flight state. Acupuncture has a really soothing effect on the nervous system and brings people back into more of that parasympathetic rest and rejuvenate, rest and digest, and also another little mnemonic we use is feed and breed when it comes to fertility, because it is all of our unconscious functions are controlled by that autonomic part of the nervous system. Absolutely. And if you are in a sympathetic state, a fight or flight state, then your body's resources are all being directed towards dealing with that.
Survival.
Exactly.
Just surviving.
They're not concerned about whether or not you can reproduce or whether or not your digestive the system is functioning correctly or whether or not you're sleeping okay. It's just like, oh, we gotta, whatever the emergency is here, we gotta get through this.
Right.
And so acupuncture just kind of helps put you back in that rest and rejuvenate state. The herbs help to sort of nourish and strengthen reproductive function. It just rebalance endocrine function and just the way your body functions as a whole.
And so endocrine function, is not just fertility. I mean, that's everything from, diabetes to thyroid to, everything, your whole body. And something people hear me say over and over again is pay attention to your stress, your sleep, your gut, your gut health and all of that. And that is exactly what you are focusing on entirely, it sounds.
Absolutely.
That's wonderful.
Absolutely. Like I said, Chinese medicine, it really is a functional medicine. Yeah. And so we look at very much the same things that you do when you're evaluating a patient.
Yeah, the integrative board medicine, the integrative medicine board exam is almost entirely Chinese medicine based, which was a shocker to me because that's not really what they focus on when they help us, study for it, and I was really shocked with that. But that you're right, it is uniquely bonded together. So. I think when we're talking about acupuncture and all the myths, the thing that I hear over and over again is the fear of the needle. So, right? Because everybody just thinks, they hear acupuncture, they think, you're going to stick some needles in me, and are very frightened about that. So let's go over that. I know
okay, let's do it. It is such a non-issue. Honestly, like I will say that more than 80% of my patients express some concern about the needles when they come in, and probably some of them don't express it, but they are concerned. But the needles are so tiny. They're just a little thicker than a hair. They're much, much different than a hypodermic, right? Like a hypodermic needle, which is the kind of needle that they use to give you an injection or draw blood. They're meant to do damage, right? Because they're trying to either get medication into the bloodstream or get blood into the vial. So they're really designed in a way that they're like cutting into the tissue. The needles that we use in Chinese medicine and acupuncture are very, very thin. They're solid. If you look at them under a microscope, they're not really even pointed on the end. They're rounded, and a lot of the needles we use these days are laser sharpened, and they're sterile. They're disposable. So. No concerns about any of that. We use a little tube to tap them in. So most people don't even feel the insertion because that gets them through the skin. Once it's in, people will feel a little bit of sensation. It's actually good to feel a little sensation, but like a heavy, a little achy, but very mild. And I always tell patients, if you feel anything that you would describe as uncomfortable, just let me know and we'll adjust it. So I would say maybe once every couple of years I'll get a patient that's just so sensitive that they find it uncomfortable. But,
rare. So
it's very, very rare.
I actually did acupuncture way back when I was in residency because I thought I had a back problem. It turned out to be my gallbladder, believe it or not. So we got it treated. But I found it, I didn't feel anything really. And it was very, very easy to do. And I don't have a fear of needles, but I don't like to hurt either. And so that, I tell my patients, I've done that, and it really, that's a non-factor. It's a non-factor. So, absolutely. So I think that's wonderful. So how do people reach out to you, and what starts the process for them to come see you and get treated, or when do patients know that they need acupuncture?
Well, I will say that everybody needs acupuncture, really, because we're really addressing a function. And I'll often describe an acupuncture treatment as kind of hitting the reset button. Because it has this calming influence on the nervous system, and everything ultimately is controlled by the nervous system, even the endocrine function that we talked about. You calm down the nervous system, your body moves back into that rest and rejuvenate state, your endocrine function changes, your immune function changes, everything changes. And so it really works very well as a preventative medicine as well. So the earlier the better when it comes to people actually having significant health issues. Because the earlier we can get to it, the less sort of ingrained it's become, and the easier it will change. But we have patients that come in at all stages. I have patients that come in that have been dealing with back pain for 20, 25 years. I have people that just tweaked their back yesterday. So
I can imagine what you're saying is very important. I want people to understand this. I think a lot of times patients, by the time they understand acupuncture and use it as a resource, have tried everything else for years, and then they come to you. What you're saying, it's best to do that maybe first.
Right.
Okay, so that's important. I want people to understand that.
Yeah, absolutely. I mean, if there's something significant going on, you always want to go see your medical doctor. Just make sure that there's not something that's of concern.
Absolutely.
But then, before you do cortisone, before you do ablation procedures, these sorts of more invasive
and dangerous. Sure.
I think the more subtle therapies you use, the better. And a lot of times in early stages, people can get better within just a handful of treatments. Sure. Whereas if you come in after 20 years, it might take, 15, 20 treatments to get you in a good place.
Okay. Well, here's another thing that people ask me all the time. Is it covered by insurance?
It is often covered by
really?
Sometimes.
Not sometimes, but often.
It is, okay, I'll rephrase that. It is sometimes covered by insurance. We are in network with UHC. We're out of network with
that's United.
That's United. Sorry, Blue Cross Blue Shield, and so we're always happy to check benefits. That's a service that we offer just to see if you do have acupuncture benefits.
Right.
We can go from there. It is not. This is kind of a confusing subject right now because
absolutely
Medicare is in the process of getting acupuncture into the system.
Finally.
They have the acupuncture procedure codes in the system, but they don't have acupuncturists in the system. We're not Medicare-approved providers. So there was a lot
that makes sense.
There was a lot of information that came out several months ago when they put the codes in. It's like, acupuncture for back pain. That's the only thing that they're planning on covering, at least to start, is covered by Medicare. And so we started getting a lot of calls.
Sure.
But at this stage, it's not because we can't build those codes. Yeah. But yes, some insurance companies do offer acupuncture coverage, and we're always happy if you give us a call.
Is it expensive if you are not covered?
It's not, because most of our patients don't have coverage. Well, with insurance, the only thing they ever cover really is pain-related conditions.
Sure.
And since we treat people for such a broad range of conditions, I'd say probably 75-80% of our patients don't have acupuncture insurance coverage, so we try to make it affordable.
That's great.
It usually ranges between $85 and $100 a visit, kind of depending on what
that's
we're
not bad
doing.
at all, really. Now, I know that's expensive to some, I get it, but when you're talking about accessibility, there are many ways. $80 is eating out twice a week.
Right.
So you have to frame your lifestyle to taking care of yourself, not just whatever's convenient and, get you through the day. Right. You're talking about people who are, exhausted and hurting and, toward the end of the day, just want to get home, so they're just going to pick up something or DoorDash it, they'll drop that money on anything. If you can turn your life around, get the feeling better, get your body back, you're not going to be that exhausted. You can go home and cook a great meal for yourself. That $80 is so much better directed, or 80 or 100 or whatever, is so much better directed to taking care of yourself, so that's important. Absolutely,
and it's not something that's we're going to be doing on an ongoing basis at an aggressive pace. A lot of patients, we do a series of treatments, and then they're good, and they really only come back if they needed a tune-up. And the other patients that have more chronic issues, or there's something about their life, either with the way they work or a sport that they play or a hobby that they have that. Or maybe they have some more degenerative issues, like, say, disc herniations or spinal stenosis or something like that. They may need to come back on a regular basis, maybe once every couple of weeks or once a month. But generally, we can get people down to where they're just coming kind of as needed.
Wonderful. Oh, that's terrific. So this is kind of a heavy subject. We're going to enter a break here in just a minute. But why do primary care doctors or other physicians, even like orthopedists or specialists, why do they not refer more often to you?
I think it's just lack of knowledge. I
think it is too.
Yeah, and
we are not taught in medical school.
Right.
We're not.
And lack of knowing where to send patients. It's like I have many doctors that refer to me, and they'll say, "I'm just so glad that we found you," because we've had patients inquiring about this for many years,
for a long time. I
agree.
agree.
we just didn't know where we wanted to see them.
Absolutely.
But I would send them because obviously, if you're putting your reputation on the line as a physician, you don't want to be sending your patients somewhere that you don't know that they're going to be treated right.
That is so true. So this is why you are here, and we are trying to get that word out to doctors and patients and all. And so this leads us into a great point to go over to the break, because I'm going to have all of your information on the website for drpbetterlife.com. That's where you can find all the archived. This is our 78th, 79th show, I think now. So so they're all archived there, and so you're going to be there from from now to eternity, as long as the internet exists.
I'm honored.
So we'll have you there. But give us some information about how to find you.
Okay, our website is Acupuncture, ACUPUNCTURE, SanAntonio.com.
Okay, spelled out San Antonio?
Yeah, Acupuncture spelled out, Acupuncture in San Antonio spelled out.com.
Okay.
We're in off Blanco and Bitters, so near the Melting Pot Restaurant, if anybody knows where that is.
Absolutely.
And phone number is 210-479-3900.
Excellent.
So just give us a call. You can go on the website and send in a submission, and we'll give you a call to schedule your first appointment.
Easy.
We make it very, very easy.
Yeah,
Absolutely.
So that's wonderful. And that will all be on my website to find as well, all the links and everything. So drpbetterlife.com. And I'm going to take just a minute out to thank Pinnacle Research. They have been, Pinnacle Clinical Research, they have been with me for a year now and have been so supportive, and I really appreciate all that they've done. Dr. Stephen Harrison's going to be on the show next week, and so I will have information on him, and I want to give their information. And what Pinnacle is a place where you can go get screened for fatty liver, which is 1 in 3 middle-aged adults in San Antonio, 1 in 3. So if you're sitting at a table group of 3, one of you is going to have fatty liver and not know it. And they will do a free FibroScan. It takes just a few minutes, and it's painless, absolutely, and you get free information. And so in San Antonio, you can find them at 210-529-7978, and in Austin, 512-601-5788. Go to pinnacleresearch.com. Again, that is on my website as well. So we have just a minute, and I think in the primary care area, I think your reasons and your logic, because having practiced functional medicine, I'm open to acupuncture. I did it years ago, but you're right, it's not easily found. And so now that back then we didn't have, the internet and a place. I had to go to Pleasanton, for it, because I really didn't know anybody here. And you said you've been here for 20 years?
I've been in practice for 22 years, and I opened my practice here in 2004, so
gotcha.
18 years.
Okay, I opened up in 2000, so we've been kind of parallel, and that's crazy. Now that we've got the internet, now that we've got better ways of finding people and researching and everything, I think people can find you very easily. Right. But yeah, it's a whole lack of knowledge, and so when we come back from the break, we're going to talk a little bit more about it and kind of dispel some of these myths around acupuncture, because I think there's a wonderful way of treating. We'll talk about all the different things that you can treat.
Awesome.
And come back with that. So just a few minutes, we'll be back, and thank you for tuning in.
Fatty liver is linked to 2 different situations, alcohol and diabetes, or obesity. In both cases, patients can have no symptoms. In the United States, and in particular, Texas, the most common cause of liver disease in general is non-alcoholic fatty liver. Again, associated with overweight, obesity, and/or diabetes. Additional risk factors include high cholesterol, high blood pressure, Hispanic ethnicity, and postmenopausal status. At Pinnacle Clinical Research, we offer a quick, non-invasive ultrasound-based screening assessment called FibroScan. This test is done at no cost to you, and we do not take insurance. The test will measure the fat and stiffness in your liver and stage your risk and development of fatty liver disease. You will meet with a provider immediately following your scan to go over your results. If you're interested in getting more information on your liver health, please call 210-982-0320 and schedule your FibroScan today. We are conveniently located in the Medical Center at 5109 Medical Drive.
Welcome back. I am Dr. Marianne Pinkston here with Scot Taylor from I told you I was going to say Be Balanced. I knew I was going to do that. So with Balance, Acupuncture, and Natural Medicine.
Yes,
so we are talking acupuncture today, which I'm so excited about. And I know we want to touch just very briefly on the mental health aspect, because I think that's a huge problem.
Absolutely.
Then we're going to finish off with chronic pain, because then that is a massive problem. So do you treat mental health, depression,
yes,
anxiety?
absolutely. So I'll preface this by saying that if it's a significant mental health issue, obviously there needs to be a medical professional on board. But like we were talking about earlier, the 2 parts of the autonomic nervous system, sympathetic and parasympathetic. When people spend their life, stressed out, they're unrested, then they're going to be anxious.
Yeah.
They're going to be irritable. And like, depression in Chinese medicine, we kind of look at as like anger and frustration that's kind of reached this point where it can't go any further, and then it collapses on itself.
Okay, makes sense.
So a lot of people that just have sort of lower grade issues with depression and anxiety, or just frustration, especially like with the pandemic here recently, I've been running into a lot of people that they just don't feel like themselves.
Oh my goodness, yes.
They're just more irritable than they would normally be.
Sure.
And that is often just a symptom of your nervous system running a little too
Absolutely.
hot into
Right.
that symptom. And because of acupuncture's ability to sort of just soothe and relax, we have a lot of patients that will comment that they find it to be even more relaxing
Absolutely.
than a massage, because it just has a really, really deep impact on your ability to just let go and relax.
Absolutely. I think that's wonderful. And so, speaking of the kind of the recent changes in our environment and all, there has been a huge push to get people off of opioid medications. The chronic pain, as we've discussed in Global Pain Association and worked with, is a huge issue, probably too big for our time today. But what about chronic pain and acupuncture? I think this should be really highlighted.
Absolutely. Yeah, acupuncture works for pain. There's a number of mechanisms that we understand, and a lot of them are related to like the local tissue response. It causes muscles that are too tight to relax. It causes muscles that are basically turned off to kind of turn back on and start functioning again. It promotes a healing response in the tissues, because we are, even though you don't really feel the needle, we are inducing a small micro injury in the tissues that just sort of triggers the body's natural healing
Absolutely.
capacity. It decreases inflammation. It promotes blood flow. When it comes to chronic pain, one of the main things it does that's super helpful is it causes your body to produce natural opiate-like molecules,
Absolutely.
Like endorphins and enkephalin. And so that sort of thing, it takes a little bit longer for that effect to kick in. If somebody comes in, they got a crick in their neck, often 1 or 2 treatments, they're good as new, because all it was a muscle that was in spasm. So the acupuncture has a really strong effect on relaxing that tissue, and the muscle goes back to normal and everything's good. But if somebody has, let's say, spinal stenosis or a herniated disc or something like that, we're really relying more on those long-term effects, like the increase of the endorphin. And that, once we do a series of treatments, and those levels of endorphins have actually been measured in the blood to go up substantially,
Absolutely.
then we can kind of take our hands off the wheel a little bit and drop back to more of a maintenance, and then people come in periodically, and we give them a treatment just to kind of keep those
That's
levels
great.
up.
So
Yeah.
how often do they come in at first?
Initially, we'll start with at least once or twice a week.
For how many weeks?
It kind of depends on the patient. It depends a lot on,
Sure it does.
on just how long things have been going on, how structural
Sure.
their issue, like how significant their issue
How
is.
long it's been there,
How long
all
it's
those
been
things,
there.
sure.
The general health of the patient also plays a role.
Absolutely.
Yeah.
I think the thing I want to highlight off of what we've just said is it's a process.
It's a process.
So
Exactly.
don't expect to go in and have the magic at one visit, which is
Right.
true for anything I
Right,
treat.
right,
What
right.
I always weight loss, anything.
Right.
So, and I'm sure there's something for weight loss too in acupuncture as well. So, but that is much too large for our topics today. But how wonderful! I have really, really appreciated you coming on today, because I have a huge heart for acupuncture, and I think it needs to be known and out there, and we need somebody wonderful that we can refer to. So I'm hoping everybody is listening and interested in coming and checking out your facility and you and your skills. And so thank you so much for
Thank you
for
so
being
much,
on.
Mary. I really appreciate you having me. This was
Absolutely.
great.
We'll do it again too. So don't
Let's
worry.
do
We'll
it.
have a follow up
Sounds
and
good.
talk about another huge topic
Very
that
good.
we can't get
Perfect.
into today. But so I repeat one more time about where people can find you.
Sure. It's Balance Acupuncture and Natural Medicine. On the web, we're at acupuncturesanantonio.com. And phone number is 210-479-3900.
Excellent, thank
Yeah.
you. And then I will take all of that information and put it together on my website for you. So go to drpbetterlife.com, and keep in mind that not only do we have this show, but I've got more than 70 others that you can go through and talk about all sorts of subjects and all sorts of great people from San Antonio and nationally. So please check check that out, drpbetterlife.com. I'm also in the northwest, more west side of San Antonio. I do practice medicine here in San Antonio, so I'm accessible to you. And you can find all of my information again, drpbetterlife.com. You're going to be saying it in your sleep now. And you can reach us at 210-698-7825. I want to thank Pinnacle once again for sponsoring me this year. And then we are going to leave with a note. I have a very special friend of mine that died 2 weeks ago, and Alberto Del Campo, very, very good friend. So if you're out with us, Scott, I'm going to dedicate this show to him, because he was very into acupuncture and natural medicine, and a great, great human being. So Alberto, we miss you very, very much. So everybody, have a great week. Thank you very much, and we'll see you next time.